Dr. Robert Marshall. Dr. Marshall, good morning to you.
Good morning. Thank you for having me this morning.
It's a pleasure to have you on with us. Tell us a little bit about you.
I am a board-certified occupational medicine physician. I'm originally a Buckeye, but I have come to Wisconsin, been here with my family for about 8 years, and enjoying my stint here.
Originally a Buckeye, is that just from Ohio, or did you matriculate in Columbus?
I matriculated in Columbus. I got my master's in public health there, as well as my medical degree, and I was born and raised in Northwest Ohio.
All right, so do you drop in the Ohio State when people talk to you about college?
Yeah, I do. It depends on how good we're doing in the season, I
suppose. Are you important enough to ever dot the I on the field, anything like that?
No, I did not have that degree of musical capabilities, I'm afraid.
Right. Well, maybe after this appearance, they'll be calling you. Maybe. Dr. Marshall, what exactly is occupational medicine?
Well, occupational and environmental medicine is a board-certified specialty under the American Board of Preventive Medicine, and we focus on the diagnosis and treatment of work-related injuries and illnesses. And that includes clinical care. Obviously, if someone gets hurt or contracts a occupational disease, we take care of them. We're also very much involved in prevention because that's our mothership, is the American Board of Preventive Medicine. We also get involved with disability management. And by that I mean is, unfortunately, when a employee, we can't get them back to baseline prior to their injury or their disease, we work with them to get them up to the highest level of functioning through vocational rehabilitation. We do impairment ratings to help with that as required by the state of Illinois, and also we can do permanent restrictions. We do a lot of research. One of our core contents in occupational medicine is statistical analysis, and so we do a lot of research. And probably one of our most important core content is being able to educate not only employees, but employers, as well as the community at large and governmental officials when it comes to public health in the work environment.
Dr. Marshall, I could be wrong on this, but I'm assuming occupational people with your job didn't exist in like the mid-1800s. When did this field of medicine become more popular?
Usually in the 1950s is when the occupational medicine became recognized as a specialty. Different from general community medicine at that point in time. And obviously, as things continued on with the advent of OSHA, where regulations were required and that there are certain surveillance exams and follow-ups that companies have to do with at-risk employees who are exposed to possible toxicants, then it became even more ingrained. And now the American College of Occupational and Environmental Medicine is our college, and that puts out a lot of the information that we use in going forward in research and taking care of our employees.
Must be something to look back, you go back 2, 3, 4 decades and look about what was going on in workplaces and the things that today you would look at and go, you guys can't do that. That's like super dangerous. There's a better way of going about this. No wonder you're sending 3 or 4 people to the hospital every week.
Well, it does happen. There's a lot of improvement. I must confess I've been a physician for quite a while, and I've seen a lot of changes, and for the good, to work with the employers as well as the employees to make sure things are safe, listen to what they're doing on their day-to-day activities, and trying to develop good programs to prevent injuries.
You mentioned OSHA, and that's I think when you start talking workplace safety, that's one of the first things that pops in people's brains. Do you work with OSHA for like recommendations of workplaces, or are you just two reporting bodies to each other?
Well, OSHA, our ACOM, our American College of Occupational and Environmental Medicine, does work with OSHA very closely, and also NIOSH, which is actually the research arm of OSHA that's under the Centers for Disease Control, who develop these thoughts and these plans about how things should be made better. I work with the companies in making sure that they're compliant with OSHA. A lot of them come under these regulations, and it's difficult sometimes to synthesize all the regulations and putting them together, and also have the medical expertise to go in there and make sure that that they are compliant and also making the most safe environment they can for their employees.
So when you go in and you know you're talking to different people, or the recommendations come down, is there eye rolling? Is there people going, gosh, you know, I never really looked at it like this? Having different experts looking at it from different angles has enlightened me to things we didn't know.
Well, I hope so. That again, education being one of our mainstays to make sure we know. And of course, there's always evolution in the research. I mean, when I talk to companies, you know, a lot of times they invite me in to make tours, work with their industrial hygienist, possibly occupational therapist or physical therapist, to say, how can we make this better? How can we lower the risk of injury? So I don't get too much eye rolling. I think they really are concerned, because most companies understand that their major asset are the workers, and they can't be productive and successful in their business practices if they don't have a good, solid workforce that's healthy and safe. So, no, I found my interactions with the employees and employers been very, very productive, and a lot of times we do get some suggestions in there to help these folks to prevent further injuries.
That's outstanding.
You mentioned you've been a physician for a while. Does that mean you've not been in the occupational therapy or part of the practice for a while, and what got you to make the career switch?
Sure. Actually, I was originally certified as a board-certified family medicine doctor way back in the day. I've been a physician for 40 years. Don't mind telling you that. But I got into occupational medicine because in a small community that I practiced in Northwest Ohio, we had several large companies, and there was a big frustration that came down through the Chamber of Commerce, where there were services that these companies needed that were not available in our community. And so I was a big fan of sports medicine. I was a team physician for 2 high school football teams for 25 years. And I thought, you know, this is kind of cool. Let me take a look at it. And then I got into it further and went back to Ohio State and got my master's in public health, and thought, you know, this is really cool. And it's so broad spectrum. It covers a lot of different things in the work environment, and I found that very enticing to me. So I've been doing this probably about, 32 years now.
Wow. You got the hang of it, then, is what you're saying.
I'm hoping I do.
Dr. Marshall, he points out here your work with corporate wellness programs. That's something that anybody who works for any company, seemingly, we get notes about our corporate wellness and our wellness plans. And, hey, we're going to have a wellness thing on Zoom. How do you work with corporate wellness programs?
Well, again, companies recognize that their employees are not in a vacuum. So if they have high blood pressure, they have diabetes, heaven forbid, substance abuse or something like that, those things come into the workplace too, and it affects their safety and their ability to work. And a lot of companies have these programs that say, okay, how can we help our employees to be better? Give them the education, give them the tools to make good decisions about their well-being and their health. And so to that end, we have lunch and learns where we have health care counselors, myself, nurses, certified occupational health nurses, our drug medical review officer assistant come in and give talks to folks. And it can be on any topic from work-related to non-work-related. And we focus those on the well-being of the individual. We do plant visits, like I mentioned earlier, where we can go around and look at the ergonomics of certain things. Again, we also will work directly with employee health at times. They're trying to develop a program. They're looking at their data and say, okay, we spend a lot of money on our insurance premiums on, let's say, diabetes. So we need to focus our resources on pieces on diabetes, diet, so we can bring a dietitian in. We can bring diabetic experts into talks. So there's the things that we can work with the company to help promote public health and wellness amongst their employees.
Pretty good. I'll put you on the spot here a little bit. If you don't have an answer, that's fine. But I think when you think workplace injuries, a lot of people think of, you know, the gross plant injuries, people losing arms or things like that. What are some workplace injuries, conditions that you see semi-regularly that people might not think are workplace
I
injuries?
snapped my ear with some headphones once.
That could, well, we're talking about that.
It
Well,
hurt.
it could be.
Kind of hurt.
Yeah. Well, the most common one we see, obviously, is back and shoulder injuries, mostly musculoskeletal. That's our main one. We do minor lacerations, repairs, and minor fractures. But if we get into things that are much more involved, obviously we bring in the big guns, our orthopedic surgeons and our other specialists that we need to help make sure that we get a good outcome from the treatment of our employees. A lot of things that people don't think about is there are diseases that can occur also as a result. And when I say disease, I mean mostly that's like lung diseases, and occasionally we see that. We do take care of some folks that unfortunately have developed signs of silicosis, for example, or borreliosis, or other diseases like that. There are so many different chemicals in the workplace, over 400,000 in the workplace, that are potential at risk for employees, and those are the things that we look for and we watch out and try to screen for, hopefully through our surveillance, catch them early if they do have any problems, and also those individuals who may be at really high risk. If they get exposed to some of these substances, we try to keep them out of mischief as well. So mostly musculoskeletal, I would say, is our main injury that we see.
Dr. Marshall, far from eye rolling, I'm thinking that you're probably going to be treated to a round of applause the next time you walk up someone's sidewalk. You bring a lot to the table here to make things better for people in the workplace.
Well, I hope so. That's a whole point of occupational medicine. All my colleagues that are in that specialty, we're focused on making sure that everybody has a productive life. We want to prevent disease. We want to prevent disability. We certainly want to prevent premature and preventable death from some of these diseases I mentioned. So absolutely, I enjoy this specialty so much. And actually, interestingly enough, a recent survey showed that my specialty has one of the highest satisfaction rates among the providers in the country. So I think that says a lot of what we do.
And just how special are you? How many of you are there in the Mercy Health system here locally?
Two.
Two, okay.
Yeah. Again, we're kind of rare because there's not as many residencies as there are, and so we don't run around too much. There's not many of us that run around quite a bit, but it's important to have the certification and that type of expertise because of the various things we've kind of talked about this morning already, that it's really key in order to address all the potential risks that people face in the workplace. So not a lot of us.
Well, we're lucky, and we're glad to have you here, Dr. Marshall. And by the way, I just do you a little favor. If you bump into somebody at one of these places with a nasty headphone snap injury, I'm going to go with what I went for, the frozen peas. Frozen peas against the side of the head for about 10 minutes or so. It seemed to produce good results.
All right.
A lot of times, ice is your best medicine, and tincture of time as well.
Yeah, that worked too.
Right.
Dr. Marshall, thanks for taking time out of what we know is a very busy day to spend some time with us. We learned a lot from you, and we appreciate it.
It's been my pleasure. Thank you so much.
Dr. Robert Marshall, Mercy Health.